hello everybody and welcome to Conceptual Surgery. And today we are going to talk about liver tumors. And I would want you to understand that this is just an overview of the different tumors of the liver to give you a glimpse about the different tumors, the benign and the malignant tumors, and the way we approach the tumors of the liver. Because uh, the treatment or the management of the tumors of the liver by itself is a very vast topic and it cannot be covered in a single lecture. So the aim of this lecture today is to equip you with enough knowledge that in case you get a patient in your exam with a right hypochondrial lump with a differential diagnosis of hepatomegaly which might be malignant, how to sail your way through in your practical exam. And in case you get a short note in the exam on tumors of the liver, so what exactly is expected of you and how to briefly give an overview to the examiner about the tumors of the liver. So when we talk about tumors of the liver, the tumors can broadly be classified into benign and malignant. And on the left-hand side is a list of the commonly encountered benign tumors of the liver with hepatic adenoma, focal nodular hyperplasia, nodular regenerative hyperplasia, and adenomas arising from the bile duct. Then some lesions which are not tumors by themselves, like hemangiomas and hematomas, and lipoma, which is also a rare variety of benign tumor of the liver. And on the right hand side, we have a list of the most common malignant tumors of the liver, in which metastatic tumors to the liver are the most common, non-primary malignancies of the liver, and then hepatocellular carcinoma being the most common primary malignancy of the liver. And then we have intrahepatic cholangiocarcinoma. So let us look at these one by one. Now, like I said, I'm only giving you an overview of these tumors. I'm not going into the detail. I'm just touching each of these tumors. What are the important points that you must know from the examination point of view as far as the presentation, the diagnosis, and the management is concerned. So hemangioma, as we know, is nothing but an abnormal plexus of vessels, and it is seen in many locations in the body. And similarly, hemangiomas are also seen in the liver, and it is in fact one of the most common lesions that we see on imaging in the liver. And because of the widespread use and availability of ultrasound, and because ultrasound is a fantastic modality to look at the liver or interrogate the liver, so that is the reason with the increased and the widespread use of ultrasound, the incidence of diagnosing hemangiomas of the liver has also increased. But that does not mean that it is actually an increase in actual incidence. It only means that now more and more hemangiomas are being diagnosed because of the availability of an investigation by which you can actually see the liver and see whether a hemangioma is present inside the liver or not. Uh, Now, because ultrasound is a fantastic modality of visualizing the liver, and because hemangioma is a tumor or a disorder which arises from the blood vessels, so therefore it gives a very good contrast when seen on ultrasound. Whereas the liver, which is solid, gives a grayish hue. The hemangioma, which has blood-filled spaces within it, and because the blood is fluid, so it will give a darker hue. So therefore, it is very clearly seen because of this contrast from the surrounding liver on an ultrasound. However, if there is any diagnostic uncertainty on the ultrasound, then you can always ask the patient or take the patient for a CT scan. And on CT scan, you have some diagnostic appearances of hemangioma in the form of when you give a contrast in the contrast enhanced CT, the contrast appears slowly because these are lakes of blood vessels which are jumbled together in the center. So the contrast would appear from the feeding vessel in the periphery, will first appear in the periphery and then come into the center. Now, because these are low flow lesions, The contrast takes time to appear and it takes time to disappear. Unlike the contrast in the blood vessels, where the flow is fast, the contrast appears fast and disappears fast. Now, often these hemangiomas are multiple in nature, in number, and like I said, they are asymptomatic, and it is only because an ultrasound was performed for some unrelated cause. And when the liver was seen, it was incidentally discovered to be having an hemangioma. Now, if the lesion is incidental and if the diagnosis is certain on ultrasound or on CT, no further treatment is required. Now, this is a coronal view of a hemangioma in the right lobe of the liver. And here you can see the periphery of the hemangioma. There is pooling of contrast, which is marked by these arrows. Sometimes hemangiomas may attain large proportion, and in which case they are known as giant hemangiomas. And when they are close to the surface, they run a risk of occasional rupture, either spontaneous or secondary to trauma. So therefore, if you have diagnosed a hemangioma which is large, more than 5 centimeter in size, or is present in a subcapsular location, or is symptomatic in the form of pain due to stretching of the capsule, then that is the only indication in which a hemangioma warrants treatment, and the treatment for hemangioma is resection. The next benign tumor of the liver is adenoma, and as adenoma elsewhere, it is a benign tumor, and it is derived from the hepatocytes. It is seen exclusively in women in the reproductive age group, and it is classically associated with the use of oral contraceptive pills, which are rich in estrogen. Now, you all know that estrogen is a trophic factor for hepatocytes. So therefore, in case a female in the reproductive age group is taking a pill which is rich in estrogen, there is a chance that these hepatocytes, because of the extra trophic factors that are being provided because of this pill, may undergo hypertrophy and form adenomas. These are well-defined lesions. They are vascular in nature and usually solitary. And like hemangiomas, they are mostly found incidentally on imaging performed for some entirely unrelated reason. That imaging could be an ultrasound. That imaging can be a CT or an MRI. However, rarely up to 1/3 of these patients may first present due to a rupture of a adenoma. Now, because these are vascular lesions, if in case there is a rupture, it will amount to bleeding, and this bleeding can stretch the capsule and cause pain secondary to stretching of the capsule of the liver. Now, this is how hepatic adenoma looks on a CT. So this is a cross-sectional imaging where you can see a hepatic adenoma marked with an arrow.